Welcome back to the deep dive. Today, we are taking a long, cold look at what is arguably the single most critical component in modern biomanufacturing.
And yet it's the one that's so often overlooked.
Exactly. Microbial cell banking. When you hear that term, I think most people, they just picture a freezer farm, a logistical task.
Right, just archival storage. But that's the big misconception we need to dismantle today. This is not passive. We're diving into how cell banking is really an engineered, quality by design-driven unit operation.
So it's the cornerstone.
It's the cornerstone. It's designed to manage genetic, physiological, and regulatory risk across the entire life of a product, which could be 20 years.
That immediately raises the stakes way beyond just simple inventory management. So our mission today is to unpack how this becomes a quantitative and auditable control system. The sources mentioned it ties into ICH guidelines, Q8, Q9, Q10. What's the fundamental shift in thinking here?
The shift is treating the cell bank itself as a critical material. Think of it like a formal raw material for your entire process, which means it has to have defined critical quality attributes, or CQAs. Things like identity, absolute sterility, and of course, genetic integrity. No drift allowed.
And those are controlled by
Critical process parameters, the CPPs.
Yeah.
And this is during the banking process itself. We're talking about the specific cell age when you freeze, the exact cooling rate, and of course, the long-term storage temperature.
So, if I'm getting this right, the entire system is designed to guarantee that a tiny vial, thawed maybe years from now, will seed a full-scale campaign that performs identically to a run started today.
That is the enormous constraint, yeah.
Well, how? To place that on a little vial sitting at minus 130 degrees Celsius.
It's the ultimate constraint. And it's exactly why the architecture is so rigid. You can't just have one big bank. You need a hierarchy, a system that separates the regulatory anchor from the day-to-day operational supply.
Okay, so let's start at the top of that hierarchy. The sources really stress the difference between the master cell bank, the MCB, and the working cell bank, the WCB. Tell us about the MCB first.
The master cell bank is the crown jewel. It's the immutable genetic and phenotypic reference point for the entire product.
The original blueprint.
The original blueprint, the regulatory anchor. Its purpose is to be the foundation for all subsequent testing. All your comparability studies, stability tracking, everything required over the product's lifespan is tied back to this one bank.
So it's the vault copy. You characterize it once, you test it exhaustively, and then ideally, you never use it for routine production.
Precisely. It's stored at ultra-low temperatures, less than or equal to minus 130 Celsius in vapor phase liquid nitrogen.
And that's to stop evolution, basically.
To minimize it, yes.
Yeah.
It's also made with the fewest possible cumulative population doubling, so it's as young and as stable as it can be.
And the working cell bank, the WCB, that's the operational workhorse.
That's the convenience layer.
Yeah.
It's a high-copy inventory for routine use, for seeding all your GMP production runs. But here's the critical rule. It must be derived exclusively from a qualified MCB vial. And you have a predefined depletion plan, so you know exactly when you need to make a fresh WCB from the master.
This all sounds like a system designed to catch failure before it can even happen. Which brings me to what I found really fascinating, the stress test bank. The EOPCB, or end of production cell bank. What's its role?
The EOPCD is a key part of that quality by design framework. Its purpose is to simulate or even slightly exceed the maximum planned cellular aging your cells will ever see in a real commercial batch.
So you're pushing them to the limit on purpose.
You are. You make this bank, you test its performance, and those results are what anchor your maximum cell age specifications. You're basically asking the cells, how far can we push you before quality drops off?
And the EOPCB gives you the quantitative answer.
Exactly. It demonstrates that your productivity, your growth rate, your impurity profiles, all of it holds up even under that worst-case aging scenario. It's the ultimate preventative control. It defines your operating space.
That architectural control makes total sense. But the single most important rule seems to be about the regeneration pathway. How strict is that?
It is absolutely non-negotiable. The rule is simple. WCBs are regenerated only from qualified MCB vials, period.
No back generation allowed.
Zero. You can't take cells from a production culture or a spent seed train or even from that EOPCB material and use them to make a new WCB.
And why is that so critical?
Because if you did that, you'd lose your genetic baseline. You risk capturing mutations or adaptations that happen during the high-stress production environment. You would completely invalidate the regulatory guarantee of fidelity that the MCB provides. It would be a massive deviation.
Speaking of deviations, what happens if the MCB itself, the vault copy, fails a requalification test?
That is the single largest failure trigger in the whole system. The entire bank is put on immediate hold. WCB regeneration stops. You trigger a massive investigation, and you might have to reestablish the whole system from an earlier research clone.
And that could disrupt the supply chain for years. For years. It underscores why that MCB has to be treated with such reverence.
The stakes are just enormous. Okay, that architecture really highlights the need for fidelity. But fidelity depends on knowing the true age of the cells. And when we say cell age, we don't mean calendar days, do we?
Not at all. It's all about quantifying the proliferative history using cumulative population doublings, or CPD.
And that's considered a critical process parameter.
It is. We define age quantitatively as the total number of doublings from the moment the clone was first isolated all the way up to inoculating the final production vessel.
And why is that quantitative age so much more important than just time in the freezer?
Because biological function changes with doubling. It's an empirical fact. Productivity, stress tolerance, even the lag time when you thaw a culture, all of it varies depending on how many times that population has replicated.
So by quantifying CPD, you replace guesswork with a hard number.
A measurable, controllable variable. Exactly.
The calculation itself, I saw it uses a logarithmic formula. That seems like a huge effort to track across a multi-step process. It is complex. And that just speaks to the rigor that's required. You calculate the population doublings for each step, and then you have to sum them across the entire chain.
From the initial clone to the MCB.
With MCB to WCB, and finally the WCB through all the stages of the seed train.
And this data has to be tracked for every single campaign.
Digitally and rigorously, yes. You need that history because you have to model your validated CPD limit and prove it's never exceeded. That model even has to account for worst-case scenarios, like using multiple WCB vials or having a delay in the seed train. Regulators want to see that limit locked down.
Beyond just tracking doublings, it seems like manufacturing the bank is also a proactive strategy to sort of lock the cell in an optimal state.
That's the phenotype locking strategy. We deliberately choose the manufacturing conditions to prevent undesirable drift. You don't want to just copy the end-stage production conditions because you might accidentally select for a population that's tough but, a low producer.
Can you walk us through an example of that?
Sure. For a strain that's constitutively expressing a protein, so it's always on, we typically use growth-optimized conditions. Moderate temperature, high oxygen, whatever, keeps the cells in a robust, healthy log phase state.
And what if it's an inducible system where you add a chemical trigger later on?
In that case, you almost always avoid induction during bank manufacture. The goal is to prevent selecting for subpopulations that are maybe stress-tolerant but have altered expression. You apply the stress of induction only later, in the controlled environment of the big bioreactor. You bank the naive, pristine version of the cell.
That detail is critical. And speaking of pristine versions, it seems the cryoprotection strategy is also highly customized. Treating all microbes as one big class is a mistake.
It's a huge mistake. The constraints are completely different. Your choice of cryoprotectant, your cooling protocol, it has to be dependent on the organism structure and even where the product is inside the cell.
So let's take E. coli, the classic workhorse. What's their main vulnerability when you freeze them?
With E. coli, it's all about osmotic shock. Their membrane architecture makes them very sensitive, so they need moderate cryoprotectant levels, maybe 10 to 20% glycerol, and very carefully controlled cooling rates.
And that's especially true if the product is in the periplasm.
Especially then, because any membrane damage during the freeze-thaw can cause leakage and ruin your product.
What about gram-positives? I'd assume their thicker cell walls make them tougher.
They often have a higher tolerance to the cold itself, but their main risk is aggregation. Clumping.
Oh, okay.
When cells clump, you can't accurately measure your recovery, which is a key release test, and you risk seeding your reactor unevenly. So the focus shifts to including surfactants or other controls to prevent clumping.
And with yeasts, we often see glycerol used instead of DMSO. Why is that?
That's often a regulatory constraint. DMSO is highly effective but comes with toxicity concerns. Yeasts tolerate high glycerol levels very well. And for food or nutraceuticals, avoiding any residual solvent is a huge plus.
Then you have the real outliers, like spore formers, bacillus. That's a whole different ballgame.
The entire logic shifts.
Okay.
You're not banking dividing cells anymore. The focus moves to the stability of the spore itself. Your release criteria are things like spore titer, germination efficiency, and the stability of the spore coats. You might even ditch cryopreservation altogether for lyophilization.
You mentioned that just counting the live cells' viable count is a weak predictor of success. If viability isn't enough, what else has to be on the release test?
You must include post-thaw functionality. That has to be a CQA.
So not just did it survive, but how well is it working?
Exactly. You need metrics that predict how the seed train will perform. For instance, recovery kinetics. How long does it take to reach a target cell density? And what's its early exponential growth rate, its mu, in production-like media? If those are off, your reactor run is going to be unpredictable.
That connects the lab quality directly to the industrial outcome. Okay, so now we move to life cycle control. Once the bank is made, the control has to continue for the life of the product. This is about stability trending and emergency planning.
This is the governance piece, right? It involves periodically testing retained vials, maybe annually, and putting those results into formal stability trending using control charts. You're looking for any hint of drift over time.
And those charts will have an alert limit and an action limit. Can you clarify that distinction?
Sure, an alert limit is a yellow flag. Maybe you see a small but statistically significant drift in lag time. That triggers an investigation, but the bank is still usable.
But an action limit is a red flag.
It's a hard stop.
Yeah.
That means a key metric, like CFU recovery, has fallen outside the validated spec. That triggers immediate suspension of WCB regeneration and the start of formal bank replacement planning. You stop the line before you make a bad batch.
Given these ultra-low temperatures, a freezer failure has to be the nightmare scenario.
It is the single most terrifying thing for a bank owner. Your freezers and LN2 tanks must be qualified, temperature mapped, and have continuous monitoring with alarms, backups, the whole 9 yards. But the key is the written procedure, the excursion governance SOP.
What needs to be in that SOP?
Everything. Explicit alarm thresholds, like minus 60 degrees is the action point for a minus 80 freezer. And crucially, you need clear criteria for vial usability after a short excursion.
And you can only know that if you've tested it.
You have to do excursion simulation studies. You intentionally warm some vials up to, say, minus 40 degrees for a set time, and then you immediately retest all the CQAs to prove they're still good.
So a company has to proactively simulate a failure just to prove the vials can survive a power outage?
That's right. This is what elevates it from simple storage to proactive risk mitigation. You can't just hope the bank survives. You have to have data proving functionality is maintained, otherwise you discard every single exposed vial. And that is immensely costly.
That connection between quality and risk brings us to our last area, mapping these parameters directly to the success of large-scale manufacturing.
This is where it all comes together. The cell bank attributes are structured by criticality. You have your non-negotiable criticals, identity, sterility, genetic integrity. If those fail, the bank is, garbage.
But the key attributes like recovery kinetics and growth rate, those are the ones that really dictate if the big bioreactor run will be successful.
Precisely. Your spec limits on the bank have to be justified by showing that the resulting culture won't cause a deviation in the final product. The strict limits on lag time, for example, are there to prevent problems in the multi-thousand-liter reactor.
Problems such as?
Well, if the lag time is too long, the cells won't consume oxygen fast enough at the start. You risk off-spec dissolved oxygen excursions, which kills your yield. Or if the growth rate is too slow, you might not even reach the required cell density.
And the impurity profile of the bank is another direct link to the final drug, right?
A vital link. If your bank is qualified with high basal levels of, say, host cell proteases, that protease burden will carry through the whole process. It might exceed the clearance capacity of your downstream purification steps.
And the result is?
Product degradation. You could threaten the final drug's potency or cause aggregation, all from a subtle physiological difference in the cell you banked years ago. The entire chain of control really does start at minus 130 degrees.
It's all connected.
And underpinning it all is organizational discipline. You need robust life cycle governance. That means a designated bank owner, a senior leader who is formally accountable, and rigorous change control for any modification to procedures or storage sites.
That brings us to our synthesis. What we've seen is that microbial cell banking is so much more than logistics. It's a platform discipline that integrates quantitative science, like tracking CPD, with formal risk management and governance.
And while the guiding principles first came from ICH-Q5D for mammalian cells, they adapt perfectly to microbes, with specific additions for things like higher mutation rates, plasmid retention, and testing for threats like bacteriophages.
So this whole incredibly complex design, from temperature mapping a freezer to that formal EOPCB stress test, it's all about ensuring absolute comparability and genetic fidelity across decades.
It ensures that the drug you harvest 5 years from now, seeded from a high-generation WCB, is functionally and genetically identical to the material you made today from a pristine MCB.
So here is the thought we want to leave you with. This entire system is designed to prove, mathematically and functionally, that your most critical raw material remains completely immutable for decades. How does that level of preventative control, where failure is mapped and modeled before it ever happens, compare to risk management and other complex industries you encounter? Think about supply chains, IT infrastructure, or even financial asset management. We'll catch you on the next deep dive.